Okay, great. You should have it on your thing now saying that we're live streaming.
Yeah,
so
got it.
Right, I'm just going to check in here, Katrin. I think we're going to be live in a second. Yeah, there we are. Great, good. Good. Well, hi, Katrin. Nice to see you.
Hi, nice to see you. Thanks very much for having me.
Thank you for joining us in the group. So hi, everybody who's in the room listening to us. So we've got the wonderful Katrin Jahn, Dr. Katrin Jahn, but yeah, we're amongst friends. So Katrin,
Exactly.
who's come to, Katrin is a veterinary behaviourist based over in the UAE. We've had quite a few chats, and Katrin very much is seeing things with a dog-centered care approach, looking more into the emotional support needs of the animal from a clinical and behavioural point of view, and we're going to talk about some of that today. So before we start then, Katrin, tell us a little bit about yourself, about what you do now, and then share with us a little bit about your journey into what you do now.
Yeah, sure. So I've been a vet for just over 20 years. That sounds awful when I say it out loud, but yeah, just over 20 years. I studied in Munich in Germany, and then very quickly went into practice in the UK. So I did a host of things. I did an internship at the Animal Health Trust. I worked at Liverpool University for a little while, and then in 2006 I moved over to the UAE. I worked for a local practice here for a couple of years, and then opened up my own small animal practice in 2008. And I think so. After I opened up my own practice, the practice became a cat-friendly clinic, and that was sort of really my first venture into deep diving a bit more into behavior and looking at the emotional needs of the patient. And I figured out quite quickly that as vets, we're really, really good at taking care of the physical health of our pets, but we're not so great at taking care of the mental and emotional health of our pets. So that kind of stuck with me, and our practice, most of us are fear-free certified now. So we kind of went down that route to sort of raise awareness amongst my team a little bit more. And then in 2019, I was in the really fortunate position to embark on a residency in veterinary behavior medicine. So the clinic was kind of not running itself, but I had vets in place to do that, so I could focus solely on behavior. And that's what I'm doing now. So I'm in my third year of the residency. So I see only behavior cases now. I see clinical behavior cases. I've recently built a new building just for behavior. So it's a standalone separate building from the main clinic, which has got 2 consult rooms and a big sort of training space. And that's what I do. So I see dogs, cats, I've seen a couple of horses, a few parrots and rabbits. And this summer I sat my Australian membership exams in veterinary behaviour. So I'm a qualified member of the Australian and New Zealand College of Veterinary Behaviourists. So yeah, that's me.
How have you fitted all this in? I don't know how you find the time to do this, but it's amazing. Well, a couple of things I just want to ask you on that. First of all is, where do you think that those early influences came from, where you started to think more about behavior as being very much an expression of self, an expression of need, and being very much connected to the kind of clinical considerations as well? Was there individuals? Was it personal with your own dealings with your own animals? What was it that made you to see that? Because you're right, within veterinary practice, although it is getting better, of course, there isn't enough of an emphasis on behavior and clinical connection.
Yeah.
So yeah, where did that inspiration come from for you?
Yeah, I don't know. It's a great question. I think it was always the want to do something a little bit differently. And I think all of us vets, we hate seeing animals stressed, but we often don't know a different way. There's a lot of pressure from the clients at times. There's pressure perhaps from the bosses or the practice owners to get a job done without necessarily paying attention to the needs, the emotional needs. And I think that's just something. We've got a huge stray cat population over here. So some of the stray cats that I dealt with were very stressed, very anxious, very fraught. They weren't fun to deal with. So trying to look for different ways of doing that, of making it better, making it more enjoyable for us as well, making it safer for everyone, and seeing those animals less distressed. I think that was a pretty driving factor. And then the more you look into it, the more you realize, the Bear study, about actually how many animals do express signs of anxiety when they're in the consultation room. And all of a sudden, it all starts, the dots start to connect, and you start to think, hang on a minute, actually, like, what are we doing? And I think some of my own personal experiences, if I think back to, experiences at the dentist or the doctor, where you're in that really vulnerable position, and you sometimes, well, you're always glad for that option to be able to raise your hand and say, hang on, I'm not okay. That feels a bit, a bit painful or whatever. And the realization that our animals often don't have that voice to speak up, or that to be able to raise that hand. So that's how it developed, really, and it's just sort of grown and grown from that.
And that's a big consideration. I know with vets that I've worked with who have come to understand more about the emotional experience of the animals in the practice, how initially the behavior seems to be the problem initially to them. They think this dog or this cat's playing up, or that's the behavior that's the issue. So it becomes, I refer to these things in this way a lot, I know, but it becomes a task-oriented thing for them to think, right, okay, let's get this dog muzzled, let's pin them down, let's do whatever we've got to do because we've got to do the task. But when they realize that actually the behavior wasn't the issue, it's the whole process that's the issue for the animal coming to the vets, even before they even got to the vets, let alone what goes on within the clinical practice. That's a big shift for them. And I think actually a lot of vets that I've spoken to, it's actually that initial realization started to add more stress to their work.
Yeah.
Because before they were able just to kind of go through that task-oriented thing and get on with it. As soon as that kind of genie's out of the bottle, where you think, oh, wow, this animal's struggling just being in my presence, let alone what I need to do clinically. And it's a lot. And I think this is a lot for us to think about regarding the pressures that gets put onto clinical teams, because it's easy to criticize vets, right? And vets sadly get a lot of criticism for many reasons, which are unfair, many of them. The time restraints that you have in general practice, animals who just aren't used enough to being in that environment, who are already not feeling great, because that's invariably why they're there a lot of the time. There's a lot to take on there, isn't there? And you can see why some professionals kind of find it easier to push away from that and just not be available to thinking about it.
Yeah, no, absolutely. I mean, and it's really, you've got to rethink, as you just said, the whole process from the moment the animal gets to the clinic, how that whole, the reception team, how they deal with that process of the animals coming in, distributing them into the different waiting rooms, all that sort of thing. And yeah, you're absolutely right. Most veterinary clinics have a 15-minute consult time. I mean, but 15 minutes, that's just about enough to have said hello to the client, said hello to the animal, and then you're supposed to do a clinical exam, speak about the history, maybe get some diagnostics underway. So there really is a lot of pressure, and obviously the pressure also comes from the business aspect of the business, which is to make money in that time that you have available. But I always say to my team, and we kind of joke about it now, once you've seen it, you can't unsee it, right? That's once you see that dog in distress, or that cat, that aggressive cat that's really actually in panic mode and scared for its life, once you've seen that and once you've realized that, you can't unsee it. And then I think hopefully, one would feel compelled to try and change that situation. But it's not an easy feat. And I think you have to have a very supportive management team or owner who also thinks along those same lines and actually allows that to take place. And I think that's obviously where I feel, very fortunate that I can kind of not do what I want, but that I can dictate, how I would like things to happen in my clinic. And even I've had pushback from some vets who perhaps started with me, and animals come in for a nail trim. That's always the classic, isn't it? The nail trim, which is supposed to be something routine, but is invariably one of the hardest procedures to do in veterinary practice, because it's potentially so painful if it's not done right. And there's always that instinct to just get the job done, to pin the dog down, have a couple of people restraining them while somebody clips their nails, and getting that message across to actually say, no, it's okay. You could take your time, you can feed the dog treats, we can put a peanut butter licky mat up on the wall if that helps, or you can send the patient away with some, pre-visit pharmaceuticals if necessary, and ask them to come back again the same day in the afternoon or the next day or whatever it is. And then the question is always, well, but do we then charge for that consultation that we've just done with the client? And and that's where the economical side comes in, the limiting factors of that. So it's definitely, you've got to change your mindset, and you've got to change protocols and the way that things are done in order to facilitate that and make it workable, I think, for everybody. And, you know, as we know, change is not always easy and not always comfortable. So that's something, a thing that might be quite difficult to shift. But we're getting there, I hope.
You know, so much we've just said there just really highlights the challenges, I think. I think I just want to continue on a little thread here. I want to come around to some of the amazing work you do specifically, and also thinking about how we kind of join the dots regarding a collaborative approach with other parts of the care circle,
Yep.
if you like, trainers, behaviourists, physios, that kind of thing. But what you just said there is really interesting for me, because I think both of our communities, both on the behaviour training side and the clinical behaviour side, and more openly the clinical side anyway, there is a kind of a growing realization that we're looking at a new horizon now, where we've done in both communities the same thing for quite a long time. And it's recognizing that a lot of what we do and how we work potentially isn't fit for purpose moving forwards. There's a lot of things to consider, and some of the challenges you mentioned there about the time constraints, the extra kind of care that's needed, the extra capacity to do these things. These are big things for individual practices to take on. So there has to be a cultural shift within that practice, and I guess within the place already. Because you were saying that you're involved in building a new behavioural unit there. So that's literally from the ground up, isn't it? It's literally a space that you are looking at and thinking, how do we do this so that it can be worked best for the kind of clients we're going to be seeing? So that's a real luxury, though, isn't it? That's not what the average practice might get. So from your point of view, then, being in the clinical community, do you think there are enough fundamental shifts going about making these extra considerations and joining the dots, or do you think it is very early on that it's just the kind of beginnings of conversations?
Oh, yeah, it's a great question. I mean, if I'm completely frank, I think we're probably pretty early on, if I'm honest. I think there is awareness out there, and I think there are individual vets who are thinking, you know, bigger picture, and are thinking a lot more along the lines of, you know, the emotional health of the pets. But there's probably not been a big enough shift yet. It hasn't transpired into the masses, if I want to say it like that, or it hasn't transpired over into you know, practices, general practices as a whole, I think. Yeah, and I do feel that that's a big shift that needs to happen, and it needs a lot of support to be able to happen, I think. And that's, you know, that starts from vet schools, that starts from teaching baby vets, you know, the things that we're doing now, how we can do things differently. We know we need to bring up this new generation who can go out there and advocate and change things. That's really what we need, you know, to help facilitate the change, I think. But yeah, it's a concern, I guess, because we are still so early on, and you know, potentially there also aren't that many of us. So in the whole of Europe, in the whole of the European College of Animal Welfare and Behaviour Medicine, I think we currently only have, I think, somewhere between 30 and 50 diplomats. So that's for the whole of Europe. In the US, there are 100 and something, I think, diplomats from the American College. I know that there are a number of other you know, veterinary behaviourists who've gone through other lines of education out there, but there's not that many of us, you know, which is the other challenge, I guess, to be able to support both the clients that are having problems, but also support colleagues and, you know, veterinary teams that, you know, other vets that might have a question about behaviour meds or how to approach things differently. So yeah, that is what I instinctively think. I haven't got any numbers to back that up, but those are just sort of my gut feelings around the matter.
This is why I think the work you do is so important, and your outlook and the way that you connect and support other people on that kind of journey that's going on. Because like a lot of things, we tend to see that, for example, that dog in the vet who's struggling, and we make it all about that moment then. Like a lot of these things, whether it's kind of chronic health conditions, emotional health conditions, the answer actually isn't about that dog who's already struggling and is struggling in that capacity of that 15-minute consult. It is about thinking about supporting practices, about how they can do more educational stuff with the general public, I think, about the stuff that can be done beforehand, about educating the general public about their animals' emotional health, the things they can do at home, all these kind of things. So it doesn't necessarily have to take time up from the practice itself. It's about having that concerted effort to think about educating more people about their their companion animals' emotional health needs. I think that's an important thing that needs to obviously be talked about within the community, I guess. And like you say, the more vets who, because it's a win-win, right? If you have a less stressed animal in the practice, it's an easier job for the practitioner. It's a win-win, really. It's very difficult when you've already got that dog, cat, rabbit who's really, crawling across the ceiling because they can't cope. It's about the prep work, isn't it?
Yeah, and it actually goes a little bit further than that. I mean, stress, excessive stress influences clinical parameters. So if you're looking at an animal's temperature, heart rate, blood pressure, blood glucose measurements, they are going to be skewed if that animal is significantly stressed. I mean, blood glucose is a classic one. We know that blood glucose levels are always going to be higher if that animal has been very stressed during the process of collecting that blood sample. And if you've got a cat that comes in respiratory distress, for example, plus they're then stressed by the whole process in the veterinary clinic, that can potentially be fatal, and it can severely affect clinical outcome. If you've got an animal that's chronically stressed during a hospitalization period, let's say they've got a wound, for example, we know that elevated cortisol levels impair wound healing. So, and I think that's something that I am always sort of keen to point out to vets. It's not just that we're kind of trying to be nice, and there's always a little bit this perception of sort of being fluffy and cat friendly and fear free. There's sort of this cutesy perception of it, but actually no, it really strongly impacts what you're going to diagnose, how you're going to diagnose it, what you're going to be able to do clinically, your clinical outcome, potentially even survival rates. So it's something that we have to take seriously. It's something that is important to the animal's health and potentially whether they survive an acute episode of a disease or not. So it goes further than just, absolutely, the emotional experience is there 100%, especially for you and I. But I think, perhaps a road to convincing more vets how important this is actually linking it to the clinical outcome and how well they're going to be able to do their jobs if they've got an animal that's less stressed.
And you just identified there, the huge challenges for a clinician in practice to do a really good assessment and come out with a good prognosis, because all those factors you just described there are all at play all the time. So you've got 15-minute window potentially. You've got an emotional caregiver potentially. You've got an animal who, they don't necessarily have to be trying to bite or bark or growl or whatever. They just internally, their physiology is off the chart now. And you're expected to then try and get some kind of idea about what's happening when all these vital things that you would normally see as being measures of just normal elevation or through a clinical, from a clinical role. It must be so hard to navigate, Katrin. It's very difficult.
Yeah, no, it absolutely is. And I think, that's perhaps why sometimes vets are driven to just kind of, be that task orientated person. We know that vets are, they're very good at, data collection and working through a problem logically and making a diagnosis. And, we're taught to be very sort of linear in that approach in terms of, following where the diagnostics take us and hopefully coming up with a diagnosis or an outcome that we can then treat. But it's all the things on the periphery that might be influencing that sometimes it can be hard to see because you've got to get a job done. So yeah, I have to say, I mean, we have 20-minute appointments and sometimes we do 30 and sometimes we do 40. We take as much time as it takes, but if you're under pressure to get the job done in 15 minutes, you have to prioritize in that moment, what it is that you need to do. And unfortunately, that's where we lose sight perhaps of the emotional health of the animal.
When we start thinking in terms of best outcomes, then already there are compromises on best outcomes just from those pressures we talk about there, let alone the other things we're talking about regarding the role of that animal's potential emotional health and its connection to its physical health symptoms, all
Yeah.
these things together. Okay, I wanted to go down those kind of strands a little bit, because I think it's good for everybody to really understand the pressures put on vets and the complications here. And because, you know, for us, especially working in the behavior training, it's very easy to think, well, why aren't the vets doing more about this? Why aren't the vets paying more attention when I offer this or offer that? And I think we have to recognize what that emotional experience, we talk about that a lot for the animal, but what it is also for the vet, I think. And especially if you're in a structure and a culture within that practice, or even a culture within the more wider vet community, that still isn't that behaviorally stroke emotionally minded yet. I don't know what's happening at vet college, but I know back along the bit on behavior, I think it was like an afternoon. So you've got 5 years of study, and there's an afternoon just touching on behavior. Really, has that changed? Do you know, is that different, or is it still kind of the way it is?
Yeah, I think it's changing. So I was actually really lucky when I was in Munich at vet school. So there is actually a behavioral department there. And I actually did my doctorate thesis through the behavior department. So I must have had an interest in behavior early on. But that's my experience from my own vet school in Munich. I know that in some of the UK universities, there's more being done in behavior. I know that Sarah Heath and her group lecture at Liverpool. I know Siggy Denenberg, he's based at Bristol. I'm not sure whether he lectures or whether he just sees cases there. So I think there's a little bit more emphasis, and also the new university in Surrey, the Guildford University, they definitely are building behavior into their program. They have their program structured completely differently. So I think, yes, there is more, but I think, you know, there's still more that needs to be done. I think, you know, vet students actually need to sit in on a behavior case and understand the complexity of it, and you know, how we deal with things. And I think also vets need to understand that behavior problems, you know, whether it's anxiety or phobias or aggressive cases, are also our remit. You know, it's so often that vets are like, oh, your dog's aggressive, you know, go and see a trainer or go and see a behaviorist, when actually we need to have a look at that ourselves first to identify if there's potentially anything medical going on, but also to understand how the brain is working or not working very well, as the case may be in that moment. And the brain as an organ is our responsibility as vets, not only obviously, but it is. So we have to also take on the responsibility for behavior cases, which I think we haven't done historically so much. I think we've been quick to refer or pass on to perhaps other professionals.
You just said something so awesome there, I think, regarding vets having to consider the fact that the brain is an organ that they have responsibility for. I think that is a really, it shouldn't be, but it's a very powerful statement, Katrin, I think. And this is ultimately what we need to think about, isn't it? Because when we start recognizing that invariably most behavioral challenges, clinical challenges, they're not separate, they're intertwined. When we start thinking about the emotional and physical health of the animal, we can't just have one practitioner who is going to come in and do things. If we are, we're invariably just propping up one bit and leaving other bits potentially open. And this is, of course, why collaboration is so important. And there's lots of challenges on that, I think. And one of the big ones is historically a lack of good communication between different practitioners that are involved in the care of the animal. How do you go about, in your own personal practice, how do you go about dealing with that, you know, connecting to physios, trainers, behaviorists, hydrotherapy people? How do you deal with that? What's your approach?
Yeah, that's a great question. So number one, I want to completely underline exactly what you've just said there, Andrew, in that, you know, collaboration for me is the absolute key to getting a positive outcome for these patients. You know, and that's collaboration both amongst professional groups, but also with the client, you know, to make sure that we have this really sort of holistic approach. In the UAE here, unfortunately, we're a little bit limited in terms of physios and hydrotherapy and all that sort of thing. So we have actually, as a practice, we've done a lot of work with CAM, with Hannah, She's done, she's streamed herself in and done some sort of full day lectures with us on pain, because I think certainly from our perspective, that's an element that we can also get involved in. When I set up my behavior unit, or when I started seeing clinical behavior cases, I very quickly realized that, there's a lot that I can do. I can absolutely, advise on medications and do a lot of management and all that sort of thing, and educate clients about the emotional state and body language, all that kind of stuff. But I very quickly realized that I had one area that I probably would struggle to fulfill, and that was exactly what you do, Andrew, which is, the behavior change side of things. So, actually holding the owner's hand through some of the implementation of some of the sort of more therapeutic things and exercises to do, perhaps some of the, I don't want to use the word training, because I don't feel that training is what we do. I think, for the cases that I see, I think therapy is more what we do, but still it's hand holding owners through, therapeutic approaches and teaching them how to use enrichment activities properly, and, doing pattern games and all that sort of thing. And so I decided to look for a really amazing behavior change expert, as we now call her, trainer essentially, who's Ilse. So she's part of my team, and she's from South Africa. She now lives in the UAE. She works with me in my behavior department. And having even just that collaborative approach between the two of us, oh my God, it's made such a world of difference to our patient outcome, because we're able to brainstorm cases from different lenses, different perspectives. We can think about how we can work together to really facilitate this outcome. And we work so closely together. We both know the cases really well. She can feed back to me if she feels that perhaps the medication isn't working enough, and then I can adjust medication doses, and I can make suggestions to her as to what types of exercises I think would be most beneficial. So that's shown me the real value of strong collaboration, but I would absolutely love to have even more professionals on board, maybe other specialist veterinarians, or the GP vet, who's referred the client, physiotherapists, as we spoke about, all that kind of knowledge and, passion that comes together to really make a difference to the outcomes of these patients. I think it's so important. And I think we can get so caught in this trap of all of us kind of, hamster wheeling away in our own little section. And actually, it's when we allow ourselves to open up to the possibility of working together that we really grow and can help these patients.
Yeah, it's so refreshing to hear that, and I think it's got to be the future, right? It's got to be how it's going to have to be for the future, and there are some logistical challenges there, even with that setup. I've had a few cases recently where I think I shared with you when we spoke privately about, we had a joint Zoom with Gwen, the pain specialist from Langford. Yep. We had Gwen, the dog walker, myself, the vet, the client, all in one Zoom room talking. It's quite a complex case, but it needed that. This is the point. And I know that can't happen all the time, but I love what you said there as well about being able to share with a colleague who has a different discipline or a different speciality, and how that actually reduces the pressure. And that's exactly how I find it. And a lot of my colleagues as well, who work in collaborative ways, it's an absolute joy. The more you can have around that team, the more you can let go of certain bits and just focus in on what you're good at and have that support. And I think especially when you have, I've got a few local vets practices that I work very closely with, and a physio. It's interesting actually on the physio, my physio colleagues, I've got two that I work with closely locally. Some of my vet colleagues, not the ones I work closely with, but vets in the local area, are a bit sniffy about physios as that first thing. And actually, I think there might even be a kind of representation of physios, even from a vet point of view, that, well, hang on, I've got to see what's wrong with the dog first before they go to the physio, rather than recognizing that, especially here, my physio colleagues, they get an hour with that dog. They can look at all sorts of different things and actually write a really brilliant report back to the clinical team, then the direct clinical team, about what those observations are. And that's a big thing for us as trainers and behaviorists. Gemma Hodson doing her new dynamic dog course, Sarah Fisher, of course, and others out there that do a lot of education on good observations. We can input a lot back to the clinical team, because you get that 15 minutes, 20 minutes. I might have 2 hours with that dog to be able to feed these things back. But we have a thing locally where whoever is the first port of call is the person who case manages. So it might go to the physio first if it's a working dog, especially because they can. It might be the clinical team, might be myself. So whoever has that first referral bit, they case manage, and then they just keep the communication going with others. So it can be done.
Yeah, no, absolutely. And actually, interestingly, I've spoken to a number of trainers in the UK, and one of their biggest questions is always, I can see there's something not quite right with the dog. I don't think it's just, behavioral. I think there might be something going on there. I think there might be pain there. The dog's been vomiting, his stool's really loose, or, I've noticed they're itchy, their skin's irritated. So the trainers pick all that up because, as you've just said, they get to spend so much more time with the dog. But then how do they feed that information back to the vets? It's happened, well, they tell me it's happened so many times that they send the dog back to the vet saying, I feel there's something not quite right with this dog. And then the vet says, well, what am I looking at? And then the trainer says, well, I'm not sure. I just feel that there's something not quite right with the dog. So we've spoken a lot about, actually data collection. So how can the trainers collect data to feed back to the vet that makes the vet go, aha, I can do something with that information, whether it's this dog defecates 6 times a day, or, this dog, when it walks in a straight line, or when it walks up the stairs or jumps into the car, I've noticed it do this. So I think, as we've just spoken about, we've got these 15 minutes in a vet consultation. And then if we're trying to almost try and decipher and figure out what it is that we're supposed to be looking for, that can be very difficult and very frustrating. So the more data almost the trainers can deliver to the vets and say, I've observed X, Y, Z, this is why I'm sending the dog back to you, over to you kind of thing, the more the vets can go, right, I can do something with this information, and they can then kind of get their diagnostic process running. So I think there's a point of, how do we communicate well with each other so that it actually makes sense for each individual party?
That's so important, isn't it? I think evidence basing is really important. And again, we've got courses like Gemma Hodgson's Dynamic Dog course and others focusing in on this. So it better equips the professional to be able to almost speak in the terms that the vet understands. I've got a physiological checklist that I put together with my physio colleagues and vets. And in fact, I think I'll put that into the group as a file, and we can perhaps just keep adding it to it as a community. Why not? But the good thing is, with the vets I work with, we have that. I've got that checklist now. And it's all done with a big question mark. So, my clients and myself will do the observations. Even the clients can look and think, yeah, my dog does do this, or it does this, but a bit like that. So it's not necessarily set in stone. And it's done without judgment. It's just, okay, there's a few things here. Then the clinical team can join the dots. It doesn't necessarily mean that just because the dog's ticking these boxes, there is a problem. And of course, It doesn't necessarily mean that if the dog isn't ticking any boxes, there isn't a problem.
There's no problem.
But it's having that joint vocabulary, isn't it, that we can all kind of talk around. And it must be difficult. I know there's some frustration in the training community sometimes when there is a perception that the vets aren't listening. But we also need to recognise, are we evidence-basing enough for them to have something to go on? Because what can they do necessarily? And I think we're not the ones who have the responsibility for prescribing medications and the potential side effects that might come across with,
Yeah, no, absolutely. And I think, that's a great point and what you mentioned earlier, Andrew, I thought was so valuable, allowing everybody to focus on what they're really good at. Because that, I think, it gives us so much more satisfaction in our job and really kind of motivates us to do the best for that dog. But it also means that, we can focus on that one area that we know we can make a big difference in. And we can, as you said, we can kind of give away some of the responsibility for the other areas that somebody else is really great at and can come in and do their bit and feel really empowered and motivated to kind of help in their area. But yeah, it as you said, it's definitely the future. It's the way forward.
So when we think about the role of a veterinary behaviourist, then for those who aren't clear about that, because we have a lot of caregivers in the group who aren't necessarily professional, and there might even be trainers who aren't quite sure. I know one thing that is the case with a lot of the colleagues I speak to. There can be mutual fear, if that's the word, maybe it is a good word, I think, between our two communities when it comes to working together. So I know myself in the early days when I first had to speak to vets, I was absolutely, bricking it because I'm not going to speak to a vet. But also now that I've spoken to vets, and now I have vets as good friends actually locally, they laugh and share with the fact that they always like, oh my God, the behaviourist is coming in. And they are also really nervous as well, because there's this notion that somehow that we're in competition, or that we are going to shine a light on each other's lack of knowledge or whatever else. And I think these are things that we only get past those by finding ways to communicate. A lot of my colleagues who ask about advice about how to best connect to the clinical team, I think the very best way, it's okay to go in with letters and flyers and business cards and that kind of thing, but ultimately it's seeking those clients, those dogs that you support that need that clinical intervention, and reaching out to the clinical team as part of that case management process, because that's the best way to connect to an individual vet, I think.
Yeah. No, I think you're absolutely right. I think, having a personal connection is definitely a great thing. But coming back to the point, that you mentioned about us almost being in competition with each other, I believe, I'm not 100% sure, but I believe that is because we probably don't really know enough about what each other does. So, the behaviourists feel that the vets are going to judge them or criticize them, and vice versa. And that's, again, just where that open communication is lacking. I know for a fact that before I got involved in veterinary behavior, I didn't know that much about behavior, and it would have been absolutely fantastic for me to be able to have a conversation with the behaviourist. But at the same time, I didn't quite know what they did. And especially coming from the ages, I qualified over 20 years ago, coming from the ages of dominance and aversion and all that sort of thing, where that instinctively just doesn't feel quite right. Do you want to hand over your case to somebody who you don't exactly know what they're going to be doing? So I think we've definitely moved on, and I think there's so much more openness and there's so much more knowledge about what each other does, but there's probably still a bit of a barrier there. And I think that's probably all it is. It's just we don't really know what each other does, and breaking down those barriers is so important for us to be able to work together.
That's a really good point there. You mentioned that, because I think, the zeitgeist more generally, definitely, I don't know what it's like in the UAE, but here in the UK is still the dominance model, still this view of behavior bad, need to change it, whether you do it nicely or punitively, doesn't really matter. And of course, the vet community is part of that wider community. And I think that's a really good point there about, it's almost like our two communities were able to be back to back for such a long time, as in not looking at each other, because we had, and we still do to a point, and obviously it's changing, when we had a mindset of we can change behavior through operant means, or just through conditioning, and our only goal was that task of changing that behavior, we didn't need to speak to the clinical team. Why? The clinical team, equally, if there wasn't anything obvious from a clinical kind of pathology, they'll be able to change the behavior. Now, both communities in the last few years have realized, hang on a minute, you can't necessarily, you don't get one without the other. There is an interconnected element. So we're having to face each other now. We're having to find those ways to connect. And I think that's a really interesting way of looking at it. A really good point there that you made on that is that we're learning how, it's almost like two languages, isn't it? To find that middle ground about how we can communicate, and breaking down some of those, like you say, it's about barriers, really, because we all have the same interest, which is looking for those best outcomes. Yeah. So tell us a bit about the veterinary. I interrupted my own question there, but tell us a little bit about the veterinary behaviourist role for you. Then, what is it that you do specifically, and where do you fit in that series of cogs that we have with the different professions that come around for the care needs of the dog?
Yeah, so I think there are a couple of things. So I think that the first thing is obviously the actual physical side of things. So if we have an animal that has chronic pain, or that has a neurological disorder, or that has a gastrointestinal disorder, which often, presents as a behavioral disorder. So kind of deep diving into that, hang on, have we got something organic or something physical that's contributing to this behavior? So I think that's the first piece of the puzzle, is being aware enough that we search for those things if we have an animal that's presented with a behavioral challenge. The second thing is what we sort of spoke about earlier a little bit, is that brain health piece. How can we make the brain function more optimally, more healthily? How can we engage certain parts of the brain? How can we help to reduce the sympathetic drive if it's not serving the animal? How can we optimize neurotransmitter function? What are the neurotransmitters that I need to be looking at? And that's obviously where prescribing medication comes in. So really looking at the different sort of pathways, if you like, in the brain and the different neurotransmitter systems, and targeting those that we think need some help and support to help the brain function more optimally. And only then, when the brain is in that receptive state and we've lowered arousal levels and we've addressed all the other things, only then, I believe, is the animal able to learn, regulate emotions, find different coping strategies, actually start to regulate their own emotional process. But you need a healthy brain for that. And we kind of all know that from ourselves as well, right? If you're in a state of stress, or if you're in a period of stress, if you're going through exams, as I did in the summer, you're very aware that sometimes that affects how you think about things, or how you're able to process emotions, or how you're able to cope with certain situations. So that's, I think, the second piece of what I feel a veterinary behaviorist does. And then the third piece is really about managing the welfare of everybody. So that is the animals that are involved in the process, but also the humans that potentially are involved in the process. And having those honest and sometimes difficult conversations with clients about what's required of them, managing expectations, providing some kind of a prognosis. Potentially, that's not always easy to do, and we try and often stay away from that, but giving them a big picture view of something. If you've got a dog, I mean, I've had cases recently, a very young dog, 20 bites to the owner, 20 owner directed bites in the first 9 months of its life. And, we really had to look at the bigger picture of what was going on there. So I think, and you're probably better at this than I am, Andrew, the client kind of counseling side of things. And even though I'm not really qualified to do that, I'm not a psychiatrist or a psychologist, but I think that's an important piece of the puzzle, is really having those honest conversations with clients. And safety management is such a big piece for us as well, is trying to ensure that nobody gets hurt or bitten, if there are children in the family, really raising the awareness for what potentially could happen. So I think those are certainly the three pieces in my situation that I see my participation most in, is so the physical, the brain health, and then really the sort of setting the big picture and advising clients on where we're going.
So I really hope the trainers and behavioural practitioners listening to you with what you've just said there really take on board what you're saying regarding the many different things that need to be investigated regarding the animal's health, mental health, neurological health, all the kind of things that can be impacting. Because there's two really important points I want to make on the back of that, Katrin, because I think this is the crux of a lot of this stuff. First of all, when we have these cases and we find them really difficult, and it seems that the training we're doing just isn't working, and we take it on ourselves as though somehow it's us, there is potentially something very fundamentally neurologically, physiologically going on there, a pathology that hasn't been identified. And we must think about that now, especially as we move beyond the operant, as we move beyond this notion of somehow I've got to try and change that behavior because I can, and recognize the many motivations from a clinical point of view. But the second thing, this is really important, and we touched on this a little bit off air, this notion that somehow a veterinary behaviorist is the end of the line. It has huge value at the beginning of that process to really think about, okay, where are we at with this animal's brain, physiology, biology, health-wise? What is going on? Are there any indicators here that actually there's something we can do as part of the clinical team to help any further process happen more smoothly and have a better chance at those results.
Yeah, absolutely. And I think I shared with you, Andrew, I always kind of think, oh no, when I hear the phrase, you know, you're our last resort, people come to me and they say they've tried everything else and now they're coming to me as a last resort. And I just think to myself, oh my goodness, you know, I haven't got a magic wand. I'm not entirely sure, you know, what the expectations are in me. And I just wish that we wouldn't be the last resort. I wish we would be the first port of call, so that we can set the animal up physiologically and, you know, health-wise to get the best outcome of everything else that follows. Yeah, I just, that's something that I not struggle with, but I find frustrating at times, is that we're seen as a last resort. You know, nothing else has worked, so let's send it to a veterinary behaviorist, give it some medication, and hope it gets better. No, that's not what we do, and that's not how it works. That's absolutely not how it works. You know, we can't then give the magic pill that's going to fix everything. We need to be there right in the beginning to optimize health, brain health, so that everything else can take place afterwards.
Do you think there'll be a point in the future where every, not necessarily individual building, but practice more widely, because obviously a lot of practices have multiple vet buildings, every vet practice will have a veterinary behaviourist in situ?
Oh my God, the dream.
The dream,
mean,
yeah.
Right, that would be absolutely amazing if that were to be the case. I know that some of the corporates, and in fact, I don't even think that some of the really huge corporates in the UK certainly have a veterinary behaviourist on their referral team to be able to manage cases, even for them internally as a group. So we're a long way away from that yet. But oh, wouldn't that just be the dream? Yeah, that would be amazing.
So a couple of things on that. I know I've spoken to trainers and behavioural practitioners. I use behavioural practitioners because in the UK I'm classed as a certified animal behaviourist. I know in America you have to have a degree to be a behaviourist, but if we just use the more wide term behavioural practitioners, anybody who deals with behaviour. I know some of my colleagues I've spoken to have felt threatened by the thought of that, thinking on how I'm not going to see any cases then because they're going to all have it. And like you just said, it doesn't work like that. It's that first port of call, and then connecting to those colleagues that you trust and respect in the local community who can provide the actual ongoing support that's needed. And I think that's a really important point for me. One thing we do know with the bigger corporates is that I've heard rumors, whether it's true or not, that one of them is looking at having outsourcing their initial behavioural triage to a kind of a call centre-y style thing. You think that would potentially stop that dream of having a veterinary behaviourist in situ and have it more virtual, where people aren't actually seeing the dogs? Or do you think there could be a balance between the two?
I think there could definitely be a balance between the two. I think, you know, I do, and I think many of my colleagues as well, due to COVID, we've done quite a lot of consultations virtually, and actually they've been very effective, and that's worked pretty well. So I think there's definitely a way forward there. Obviously, it's always better to see the animal, and I for sure feel more comfortable when I've seen the animal. But you know, I do a lot of behavior consultations in the UK, and we do all of that virtually together with videos and floor plans and all that sort of thing. So yeah, potentially, you know, I think a combination, or, you know, both of them would be good first steps. I think better than nothing. And just to go back to the point that you made earlier, if every building did have a veterinary behaviourist in situ, I think you guys would be busier than ever, because we would identify the problem potentially, and we would happily pass you over then to, you know, a really great behaviourist, or pass the patient over to a really great behaviourist to carry on working with them. So I think, in fact, trainers and behaviourists would be busier than ever if we had more veterinary behaviourists. I strongly believe that.
I agree. And actually, the vet practices that I work closely with, you now have a better understanding of behaviour, identify more within the practice.
Yeah.
And I think that's another important point, actually. And we've got to start recognizing that we're all kind of spokes on the same wheel, that we all have an equal and important part to play, but we've got to have that hub in the middle, and that has to be the clinical team. I think you know, I think it makes sense. As a veterinary behaviourist, do you find that generally, you know, on most of the time, the general public who come to see you are more likely to listen to you because you're a veterinary behaviourist, or do you find there is some resistance because they think, well, what's this got to do with my dog's behaviour, and why am I listening to you? Is there some suspicion because it's a clinical part of the clinical team talking about what they perceive their animal to be doing behaviourally?
So the clients that come and see me have specifically sought me out. They've come to me because they wanted a veterinary behaviourist perspective on their animal's behaviour. So I think that's the one side of things. But obviously, I've worked in general practice, for many, many years, and it was actually a little bit the opposite. People were keen. There were lots of questions about their animal's behaviour. My cat does this, my dog does that. I don't exactly know what to do. And, we used to kind of dismiss them almost a little bit, like, maybe try this, maybe try that. Not sure. If we had a behaviourist at the time to refer them on to a trainer, then we would do. But actually, I do believe the general public, they would like more information from their vets. But I think as vets, because of the time constraints we spoke about and because of the lack of our own education, we haven't been in the position to fulfill those needs. So yeah, although having said all that, in many of my consultations, people have usually asked Dr. Google, the man down the pub, their neighbour, everybody else before they finally do ask me. And again, that's that whole last resort piece. So I think all different varieties are possible. I think people want information from their vet. They may seek out a veterinary behaviourist, but they may also seek information elsewhere and be suspicious of what the vet's telling them. So I think there's all kinds of possibilities out there.
I think that's really interesting and really important. The reason I asked that is because within the dog centre care group, especially, we've got a really good amount of caregivers in the group, as well as we've got dog walkers, groomers, vets, trainers, behaviourists. But the caregivers especially, we're coming to terms with this multi-agency, the need of a multi-agency collaborative approach. And it's easy to kind of overlook the fact that the caregivers need to be aware of that as well. I think to recognise that actually we're all in this to support their animal, and actually the dogs, or I'm talking specifically about dogs, but any companion animal, their behaviour is what we all use as part of that data collection to try and formulate a bigger picture, which includes the clinical team.
Yeah.
And yeah.
No, sorry, go ahead.
No, I was just going to say, I think it's a thing for the caregivers to get their head around as well. About I've worked with my own clients who are like, well, why do we need to see the vet?
Yeah.
And why are we going to the vet, or why is the vet getting involved, or why do we need to go and see a physio? I don't understand. And it's just them realizing that, just like with ourselves, we go and see our GP, and then we get all these other specialists that come on board to look at the various different areas.
Yeah, and I think the key there is that I think we just haven't been used to seeing that kind of approach in the veterinary field. We're used to it from ourselves and from the human field, and we know that we get referred to a specialist, and it happens to some degree, obviously, in the veterinary space with other specialities. But I think just we're not used to seeing that type of approach when it comes to an animal's behaviour.
When we think about this notion of it being behavioural as opposed to anything else, in your experience, is it ever just behavioural? Do you find, especially with those animals that kind of their behavioural profile is very big, their behavioural challenges are very big, do you find that most of the time, maybe even all the time, there is physiological elements to that case?
Almost all the time. And, that can be as simple as lack of appetite, vomiting and diarrhea, stools that are soft or frequent urination, frequent defecation, itchiness, skin irritation, chewing themselves, all that kind of thing, and obviously chronic pain. Yeah, almost always you will see something physiological, especially the cases that I see, because they are so complex. It's very rare that I see a case that is very much straightforward. They're all complex. And I think I always say to sort of other vets who I speak to, they say to me, God, why are you doing behavior? And for me, I say to them, for me, these are the creme de la creme of cases, because they're so complex. No case is the same. No two cases are the same. every dynamic is different. You know, every relationship, every environmental situation is different. Every individual's had different experiences, you know, especially in their sort of early life stages. And these cases are complex. They're really, really complex a lot of the time, which is why we need that collaborative approach. We need, you know, a lot of minds thinking together about how we can best help these animals, and, you know, sometimes the whole families together. They're complex. They're complex, and they're invariably there's always something physiological going on.
And that, I really want that to be, yeah, we're coming up to the end of the hour. I can't believe the hour's nearly gone. There's a few more things I have to go over a little bit, because there's a couple of things I just want to build on that. But I think it's really important that everybody, especially caregivers, really hear what you said there, that almost exclusively there is physiological components to these animals who have these big kind of behavioral responses. And it's interesting that other vets will say, well, why are you doing behavior, as though it's somehow different? But we know the only way that that animal can communicate how it's feeling is through its behavior. So actually, that's what a big chunk of what a clinician needs to think about. They can look at vitals, they can do bloods, they can do all these things, but what's the animal telling you? Actually, do you know what? I'm not coping. And I would say myself, in my practice, and I've been doing this for about 10 years now on the kind of behavioral side of things, I work with dogs primarily, but I think exclusively those dogs who are have the most challenging presentations, there is always either something cognitive, trauma, or physiological, and those, and often all three, of course. But there is something going on there, some form of cognitive decline or dysfunction, something physiological. And dog cases are my predominant kind of field. And a high percentage, Katrin, a high percentage, in the kind of 70%, I guess, these dogs are it's more about social engagement, defensiveness, because they have a problem with their lumbosacral or something back end anyway, or something nervous system, maybe compressed nerves or something like that. But it's amazing how these things connect. And now it makes sense, right? Because these animals that we class as aggressive are just being defensive, and especially around a part of their body which is heavily involved in social engagement.
Yeah, no, absolutely. It's so interesting. It's fascinating. It's really fascinating. And the more cases I saw, the more I was like, oh, hang on a minute. These are all somehow medical cases to some degree, you know, and making that link. I mean, we know that mental and emotional and physical are all linked together, but actually seeing it, I mean, you know, in a large number of cases is really quite mind-blowing. And they're the nuances and the subtleties that you perhaps wouldn't see in a 15-minute consult, you know, which is why we do 2-hour consults as veterinary behaviorists, so that you get to actually spend time and see what's going on with these animals.
So it's very similar then to when we think about what went on in the 70s in human medicine, and that also had a knock-on effect to human psychiatry, because then everything was very individually disciplined. Then I can't remember the name of the guy now, but he came up with the kind of biopsychosocial model, biosocial psycho model, bringing all these elements in together, and that's become more the norm now in psychiatry and also in human medicine. We're going into that transitional stage now, aren't we? In our different communities, recognizing the whole rather than the individual. And I think it's a really interesting and exciting, but also extremely overwhelming time. I know from on our side of the thinking about behavior, for me, I flip between being really excited and being hugely overwhelmed.
Yeah.
Because once you realize, oh my God, there is so much more here that we're just touching the surface on. And there are many, many dogs that will never be able to join those dots enough, sadly. It's hard.
Yeah, absolutely. And I'm with you. I'm also either in, you know, total inspiration and excitement, or I'm in total overwhelm. You know, I totally understand where you're coming from. And the other piece around that is communicating that to the guardians, right, or the caregivers, is communicating, okay, so your dog has, you know, some behavioral challenges, but they also have potentially a gastrointestinal disorder, potentially chronic pain, potentially chronic nausea, potentially, you know, a number of things. And we need to treat and address all these. And you know, there may be financial limitations, there may be limitations just as to how much that person can take on, you know, they've, by the time they come to me, they've often, you know, been through this really long journey of trying to help this animal. And now they come and see me, and I tell them, you know, X, Y, Z, we need to address all of these things if we want to make progress. And all of a sudden their minds are blown, and then they're in overwhelm, and they're just like, whoa, you know, we can't deal with all of this. So it's really about breaking down the information and you know, trying to piece things together in a way that's digestible also for the guardians.
This is another good point, isn't it, about the cost implications and the currently the lack of connectivity with insurance even, and behaviour is seen as something very separate. It has a smaller amount of money in the pot for these cases. And a lot of people tend to think about getting insurance because they're worried about their dog breaking their leg, not because their dog might struggle being home alone, or their dog might develop other anxieties. I think we need to have a conversation on many different aspects of this: insurance companies, clinical teams, behaviourist trainers. And I think it's really interesting looking at other care sectors. So even grooming, I'm the behavioural consultant for the British Charles Grooming Association, and there's becoming a shift in the grooming world, not just from understanding the importance of a more cooperative care approach to grooming, but also recognising that many dogs will see the groomer more than they'll see a trainer or a vet or anybody else. And they're a good place for some of these early observations to be seen, and seeing how that dog is able to or not able to stand on the table, or how they move around, or how they act in that kind of setting. So I think there's a big scope here for education on multiple levels with different areas of the different communities, isn't there?
Yeah, absolutely. And I love what you just said about the groomers. I mean, you know, if we think about sort of Sarah Fisher's approach, even just looking at how the coat, you know, coat might be different in different areas of the body, and, you know, if they are groomed, are they painful in any particular areas? Again, everybody that spends time with that animal, especially the professionals, obviously, and the guardians, you know, everybody is going to collect a piece of information about that animal, and it's then about bringing it together and coming up with a plan that really works for that animal and works for the family unit as a whole.
Right, flown by, hasn't it? That's really flown by. But what I really wanted to do today was to kind of demystify the veterinary behaviourist role and give people a better idea about what you do, and also to think about some of the interconnectivity between our different professions. And I think we've covered a lot of stuff today, actually. I think it's going to be hugely useful. It'd be great to have you back next year, actually, I think, so we could maybe deep dive more into what it looks like regarding that interconnectivity. We could have a look at that for sure if you know. Well, thank you so much. What would you like to share with us as a kind of a parting comment, or you know, how you feel things are going for the future, or anything really important that you wanted to mention before we finish up?
I think a couple of things. Number one, I'm hugely hopeful for the future. I think, you know, the coming together of minds, you know, the wonderful group that you've created, it is just so invaluable to kind of start talking about these things. So I'm hugely hopeful for the future. I think that's the first thing, even if it sometimes feels a bit overwhelming. And the second thing is I would really love it if people could start thinking about the veterinary behaviourist as the first port of call rather than the last resort. I think, you know, that's such an important piece. I think also for the success of the case. So yeah, those would be the two sort of big things. And yeah, just thank you so much for having me, and for the wonderful conversation we've had. I think it's just great chatting about these things, and it's so inspiring, and it actually inspires me. You know, my mind is now going, you know, thinking about where we could take all this, and it's great. So thank you very much.
I think we need, you know, at some point in the future, we could do with a bit of a round table, really, with lots of different people coming together from different backgrounds and associations to kind of think about what this great future is going to look like. And I think we're all in a very transitionary stage at the moment. So that's why it feels quite overwhelming. But I agree with you. I'd like to think that maybe the kind of Katrin and Andrew of 20 years from now talking will be already taking some of these things for granted now that change has happened and that shift has happened. And so we're all kind of pioneers in our own way, really, I think, thinking about what happens next, whilst trying to deal with the challenges that we have now. Anyway, thank you so much for coming into the group today. I really appreciate it, and I know this is going to be an important talk for many people who are listening in. Well, thank you everybody for listening in. Just to let you know, just bear with me a minute. Yeah, so next Sunday, 11 o'clock, next Sunday morning. So we've got the amazing Sindor Pangal coming in from India. That's why I've had to try and get a time that was suitable for India and the UK. Then after that, let's have a look here. We've got on the 8th of December, Amber Batson. She's coming into the group to have a chat with us on Wednesday, the 8th of December. And then Saturday, the 11th of December, all these will be in the events when I put them up. We've got Sarah Fisher coming in. Sarah Fisher's coming in on the 11th of December. And I've got one more surprise before Christmas regarding chats, but I'm just waiting for a confirmation. So we've got a few things coming up, but thank you so much everybody who's tuned in, and see you soon. Thanks, Katrin. Bye.